Now, early in my career, I did some studies of drinking and driving laws in Massachusetts and up in Maine, and studied the legal drinking age here in Massachusetts, and sent a couple of my papers to a fellow named William Haddon. Haddon was the first administrator of the National Highway Traffic Safety Administration, and was also the first president of the Insurance Institute for Highway Safety. And he said to me, actually he came up to Boston to meet with me. He said, you know, Ralph, the work you're doing is fine, but your view is too narrow. What you're doing is you're focusing in on the host, on humans, and before a crash takes place. So you're talking about changing laws and raising the drinking age and so on. It's much more complicated than that. He took a public health model, host, agent, environment, and he translated it into the motor vehicle area. So we have the humans, we have the vehicles, and we have environments. And there are vehicle factors before the crash, such as your lights and your brakes and ignition interlocks. During the crash, airbags, collapsible steering columns. After the crash, non-exploding fuel tanks. The environment, what is the speed limit? Are there rumble strips on the side of the road? Are there guardrails, rails that divide highways so that if somebody's in a crash, they don't go over into oncoming traffic? How good are the EMS trauma centers? Systems and doing crash analyses to find out what types of roadways are most likely to, and at what conditions these types of crashes are most likely to take place. So it is a public health model, applies I think quite well in the traffic safety area. But of course you could think about this with gun violence, with other kinds of problems as well. At Boston University, we were actually the first school of public health to require students to take a course in health law. George Annis is the chairman of our health law department. And while law is a very powerful tool to change behavior to promote health, it shouldn't be used in every single instance to change every single type of behavior. And he set up a series of criteria that he said are important to consider when deciding whether to use law to change behavior, promote health. First, the problem ought to be important. Well, I hope I've been getting across to you that alcohol misuse and its effects on injury is important. Second, the law ought to be effective. That's how I spend my career, is studying the impact of different types of legislation. The law should be minimally intrusive. In fact, there should be no less intrusive, equally effective alternative. So if education, or let's say treatment for alcohol problems, if that were effective in and of itself, and there was no further lift given by passing a law, then we wouldn't want to pass a law. The behavior should harm other people. As I mentioned, half of the people who die in crashes involving drinking drivers under the age of 25 are people other than the drinking driver. And when we look at all age groups, it's about 40% of the people who die are other than the drinking driver. And finally, the public ought to support the law. I don't know how many of you remember the saga that went on in Massachusetts with safety belt law. Anybody remember that? We had Michael Dukakis was going to be running for president, and we had a Democratic potential presidential nominee and a Democratic legislature. And Mario Cuomo, over next door in New York, signed the first safety belt law. And Dukakis saw that it was saving lives. So he said, we ought to have one. So in about a week, he introduced the bill, and it passed. It sailed through the legislature. But there was a radio talk show host, a fellow named Jerry Williams, who said, you know, nobody asked me, nobody asked the public whether or not they want this thing. And he went and got 50,000 signatures on a petition to repeal the law, and announced over his radio program that the traffic jams in the tunnel, in the Callahan Tunnel on the way to the airport, were the result of police holding safety belt checkpoints inside the tunnel, which wasn't true, but it got people all riled up. And the law was repealed, and it took a dozen years to get that law reinstated. I remember the day that the legislature finally voted to reinstate it. What had happened, we don't have a high-tech state house. They have a little sign there that you have 2 minutes to say your piece. Please do it quickly. And I had for years been talking about, and talked to the legislature about how many injuries and deaths could be prevented if we had a safety belt law, but I wasn't carrying the day. Well, finally, the emergency room physicians from UMass Amherst, from Mass General Hospital, from Tufts New England Medical Center, from Boston City Hospital, They all got together, came into the hearing room with white coats. We didn't have computers, so they had their data up on signs, and they had done studies of what it cost to treat people who were in car crashes who had a safety belt on versus those who didn't have a safety belt on. And that was what carried the day. That was how we finally got that life-saving legislation reinstated. Oftentimes, we get the benefits of law start to kick in even before the law gets passed, as people start to discuss the need for the law and how the law could be effective if it were passed and further reducing the problem. Probably the organization that has had the greatest impact in securing passage of laws to reduce drinking and driving is Mothers Against Drunk Driving. It's just a tremendous organization, which I'm proud to say I was able to serve on their national board for 10 years and to become the vice president for public policy. They were able, since the early 1980s, to stimulate passage of over 2,000 pieces of legislation at the state level to reduce drinking and driving. And they're a very successful organization. They raise about $50 million a year. The modal donation is $20. So if you think about it, it's not a big government program. It's little people who think that they can go out and change the world. And in fact, in this area, really have changed the world. They support energy. They support victims. Their victim services is a very important part of the organization. And then they try to channel the grief of people who've lost loved ones, who've had loved ones injured in car crashes, into mobilizing to get legislative change passed. They personalize the problem. They point out that anybody can be affected by it, but they also point out that everyone can be part of the solution. Anybody who wants to roll up their sleeves and work with them can do that. They appeal to family values. After all, it's Mothers Against Drunk Driving. They have clear, measurable goals. They pay attention to research findings. They have scientists on their national board of directors, several that we fund from our institute. And they're grassroots. As I said, everyone can be part of the solution. Here's a sort of a slide that illustrates some of this. This is the cover of their quarterly magazine, Driven Magazine. That's Jesus and Maria Carrasco from El Paso, Texas, who lost their daughter Cecilia in a crash. And they then went out and helped to mobilize to get this Texas legislature to pass new laws there, the .08 law. They convened a series of conferences and set a clear, measurable goal. This is in the mid-1990s. They wanted to reduce alcohol-related traffic deaths 20% by the year 2000. So that's the 20 by 2000 goal. They met it in 1998, just 3 years later. A very important thing to do. Our Healthy People 2020 is an example of trying to have clear, measurable objectives in 26 different health arenas. And so it's a very similar process. And then they had a fantastic program called Rating the States, where every 3 years they would give a report card to each state and to the nation on how they were doing in reducing drinking and driving. This is the cover of their report card when I was chair of setting it up. This is the State House in Tallahassee, Florida. They have an atrium that looks down on the Great Seal of the state of Florida. And when I went down there to testify on the zero tolerance law, which I'll talk about in a minute, they had 750 traffic deaths that year in Florida. So they set up on risers around the Great Seal of the state of Florida, 750 pairs of shoes. And then they had a candlelight vigil where people would get up and tell the story of someone who they knew who had died in a drinking and driving crash. So I didn't have a loved one who had perished, but I did know about a young boy, Stephen Ross, who I'll tell you about in a minute, from Massachusetts, who was killed in a crash involving a teenage drinking driver. And so I talked about him, and so it went until they had 130 people standing around the 750 pairs of shoes, having told their stories about lost loved ones. I remember Carolyn Nunnally, who later became president of MAD, standing next to me, touching her daughter's baby shoes who had died in a drinking driving crash. So very powerful. And ultimately, the cameras were popping away, and the law passed unanimously, and Governor Childs signed that bill. Here in Massachusetts, that year, we got a C-. We're a rather arrogant lot here in Massachusetts. Got all these fine colleges and universities, and think we're a little smarter than everybody else. So you can imagine what happened when suddenly Massachusetts ended up getting a C- on a report card. Well, the governor, we then at that time had a Republican governor, I won't say which one it was, but we had a Republican governor and a Democratic legislature, and the Republican governor said, let's have a Mothers Against Drunk Driving Day. So they, all of 200 reporters showed up in the press room outside the governor's office, and the governor pointed over to Paul Carrot, who was the senator from Springfield, Massachusetts, who was chairman of the Public Safety Committee. And he said, you know, it's your fault that Massachusetts got a D in legislation. We introduced a bill to lower the legal blood alcohol limits 18 months ago, and it's been sitting in your committee. Well, Paul looked over at me and said, you know, Ralph, it's in the Criminal Justice Committee, it's not in the Public Safety Committee. So the governor didn't really, he hadn't been following through either. And a hand went up in the back of the room and said, there's the reporter from the Boston Globe. Governor, I have a question for you. If you're doing so great, how come you only got a C on the report card? What they were essentially saying is, look, you have to put bipartisan politics aside if you're going to try and make progress. And I'm happy to say this is one area in the United States where you actually can get Republicans and Democrats to work together and make a positive change happen. So on the report card, what we would do is we would look at how good are the records, how many fatally injured drivers are tested, how good is the enforcement, how many of the 30 different laws that we had science would say would be effective had been passed, and how many had been passed since the last report card, what kind of programs for youth did they have, what were they doing around victim issues, and so on. And it was a great exercise, because what it did was it got everyone in Mad's organization looking at the same data, thinking about the same issues, trying to be objective in quantifying this, and it served as a very useful reference. I've seen senators use the MAD report card at public hearings, and it helps them to frame their questions. And it's also very effective in describing, if you put everything at the state's grade all on one page, and you have a press conference, a reporter comes up from California and says, well, how's California doing? I said, well, you got 0.08, you have administrative license, but you don't have zero tolerance, or you don't have this or that and the other. And you can very quickly summarize what types of things need to be done in order to change things. This type of thing, by the way, could be done not just on drinking and driving, but this could be done about lead paint, this could be done about homicides, suicide, other types of public health problems.